This is One on One. We're pleased to be joined by Darrell Terry, Senior President and Chief Executive Officer of Newark Beth Israel Medical Center and Children's Hospital of New Jersey. Good to see you, Darrell.
Good to see you, Steve.
Let's talk healthcare. But what's interesting at your organization, it's not just healthcare per se. It's tied very directly to the community. We were talking with Barry Ostrowski, who is the CEO of the entire system, about these issues. Let's talk about the community involvement first. What's Hire Newark?
Hire Newark is an initiative that was started with the mayor's office, but joined in with RWJ Barnabas Health and Newark Beth Israel Medical Center specifically. We have 9 employer partners that work together to hire Newark residents. It is a 6-week training program where we find people who are hard to employ, and we give them work skills and training skills and interviewing skills. But the neat thing about it is at the conclusion of the program, there's a job waiting for them. That's
a big deal. I remember there was a community advisory board meeting I was pleased to moderate at Newark Beth, where we actually announced this program, and it had kind of a real big impact on hiring, training and hiring people in the community. By the way, let's make it clear that Newark Beth is tied to the larger RWJ Barnabas health system. Could you make it clear where the Newark Beth footprint is?
So Newark Beth Israel is one of the 11 acute care hospitals of RWJ Barnabas Health. We're in the South Ward of Newark. It's Newark Beth Israel Medical Center, a 665-bed licensed bed hospital with the Children's Hospital of New Jersey.
Who comes into the Beth?
We have patients from all over New Jersey for our tertiary programs, the advanced lung program, the advanced cardiac. This past Saturday, I was at a heart and soul walk where we had a lot of heart transplant patients who walk to help other heart transplant patients.
They're called tertiary. By the way, explain that, what that means.
So it's just high-end, high-tech services, advanced services. So many places have heart surgery or lung surgery, but we have heart transplant. We have we have all the available heart remedies, if you will, available.
But the other side of this for Newark Beth Israel is that the charity care piece is big, meaning those who often lack the economic means will come to Newark Beth. Make that clear. Who's that population?
It was a larger charity care population before the Affordable Care Act. So we did exactly what was contemplated under the Affordable Care Act. We signed people up for insurance. So a lot of charity care patients have converted into Medicaid managed care patients. So they're typically healthier once you have an insurance product. And so we're actually see anybody who comes in our doors. So there's still some charity care, but many of the charity care now have some insurance.
Darrell, you know, it's interesting. You and I have had these conversations offline about the importance of educating individual community members about managing their own health. Talk about that and the role that a healthcare organization plays in helping folks do that.
Well, we have to give them the education, the awareness, the tools to help them help themselves. So we have a number of initiatives there. We have the Greenhouse at Newark Beth Israel, which is very
The Beth Greenhouse.
The Beth Greenhouse. Just an incredible access to healthy fruits and vegetables. And we also have healthy cooking classes. So we can take the fresh fruits. About a month ago, Congressman Payne came to our center. Him and I went and we picked fresh vegetables out of the greenhouse. We went across the street to the Reverend Ronald B. Christian Community Health and Wellness Center, and we actually cooked the food and had community members so that they can see how to make healthy recipes.
Let's talk about why that's so important. Because Newark is often described as a food desert.
Yes.
What does that mean, and why does it make what you just talked about with Congressman so significant?
So there's not a lot of access for healthy foods. It's a lot more convenient or easier. When I was growing up in Newark, you can go into a corner store, you can get potato chips, you can get sodas, but you couldn't get bananas or fruit.
Processed foods.
Right. And so we really want to teach people about it. I didn't know what was healthy food or what wasn't healthy food when I was growing up in Newark. But now we're out there, we're teaching kids. We have a Kids Fit program that manages childhood obesity, and we have a Beth Challenge, which is in 13 different churches that really help people learn how to manage their weight in a better way. It's exercise, it's eating right.
And by the way, I need to interrupt you there because I happen to know, because we've talked about this at a lot of the community advisory meetings that I've been a part of. You have personally gotten involved in this. You have personally got involved in the challenge. What's the challenge called?
The Beth Challenge.
To do what?
So it's to lose weight. It's to lose and manage your weight. And so it first started off as an employee initiative, and it was a contest. It was about fun initially.
Right.
And so I actually participated in the first one and was actually the winner of the first Beth Challenge. But after we found out how successful it was, we took it out into the community and really have had an impact, actually being responsible for over 20,000 pounds lost.
Of community members?
Yes.
Real quick, transplant initiative?
The lung transplant program in Newark Beth Israel Medical Center, previously you would have to go into New York or Pennsylvania for those services. And now, right in the heart of Newark, you have a lung transplant program with great outcomes.
And the heart transplant?
Heart transplant is one of the busiest in the country and actually has great outcomes, and the stories are unbelievable. We are coming up on our 1,000th heart transplant.
1,000. Finally, I got to ask you this. You and I have talked a lot about communicating because we've had seminars, we've talked about the challenge of communicating about healthcare. How challenging is it with all the acronyms and the jargon and the insider language about healthcare to communicate to the average person basic healthcare concepts?
It's really important to meet people where they are and not talk over them, because you have to connect with them. On Monday night, we're having Men's Health Night, where we'll have about 150 men at Maplewood Country Club, where we teach them it's a panel of physicians who will be talking to them about health. They'll have private one-on-one question and answer periods. And then we go downstairs and watch Monday Night Football. It's a great event, and it attracts people.
You got to meet people where they are.
That's right.
Real quick, can you do the Children's Hospital Initiative? What makes it special?
Children's Hospital. Many hospitals now sort of, when they get in financial difficulty, they reduce or eliminate pediatric services. Not Newark Beth Israel. We've actually been able to create and enhance our service, including having pediatric cardiac surgery, one of the biggest programs in the area.
Children's Heart Center. Yeah.
Yes.
By the way, it's interesting about Darrell. One thing I happen to know about him personally is he grew up in the same neighborhood where he happens to be the CEO right now.
Born at the Beth, met my wife at the Beth. My kids were born at the Beth. It's very personal to me.
It's a great story. Thank you, Darrell.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation and the New Jersey Performing Arts Center in association with NJTV and WNET. Funding for this edition of One-on-One with Steve Adubato at NJPAC has been provided by Investors Bank, Berkeley College, the North Ward Center, Century 21 Construction, Josh S. Weston, the Fidelco Group, and by the Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.